Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Thanks very much. Hi again, everyone. Our Thursday community service program today comes to us from Muenster Memorial Hospital. Very happy to have Brian Roland, CEO at MMH. How are you?
Dee, doing really well. Glad to be here again this morning.
It's always great to have you. And several things we want to touch on today. Want to kind of get caught up on your newest doctor there on staff, and that is Dr. Crow Rodney. She hit the ground running, didn't she?
She definitely did, and we're really looking at a different approach with this doctor than physicians that we've had in the past. With Dr. Crow Rodney, she brings a lot more to the table. So our goal was to, how do we build a program where we can keep her here long term? I mean, that's been one of the issues in our community is the turnover in physicians. Mm-hmm. And this new contract that we have with her, the way we laid it out, our goal is not to wear her out. I want her to be able to give the patients the care they need, the time they need, and keep the quality going the way it has in the past. So in her case, she also covers the emergency room. She covers the clinic. She's also our medical record, our chief of staff and our medical director. We wanted to make sure that we gave her the adequate time to do all of those functions, mm-hmm. and to build the practice in a way to where as she grows the practice, it's beneficial for the hospital and for her. And so it's kind of a win-win for all of us. And by employing her, which is a different methodology that came into effect September 2011, she has a little more skin in the game to help make sure that we're moving in the right direction. And I hope and I feel using this different methodology that the board and I put together will actually help the longevity piece as we move forward.
Yeah, that would be great. You're right. Turnover has been a problem, and I know it's not only in Muenster; it's other areas as well. But you like to get somebody and keep them around for a while because the patients get used to them, and it's not really fair to the patients for a doctor to come and go so quickly, and it's not fair to the hospital, and really not fair to the doctor a lot of times either. So, great way to set up that with Dr. Crow Rodney. Now, another thing that's kind of been top of mind there at the hospital over the last month or so is getting this community needs assessment taken care of, and you guys have just wrapped that up.
Yes, and the exciting thing with the community needs assessment was we had over 35 participants come in and give us a lot of wonderful information on things that they think we need to do in our community, how we can work better in our community, and also what we shouldn't be doing in our community when it comes to healthcare. And that's the great thing is everybody has an opinion, and they're all really good ones. You have to take everything and figure out how do you move forward. The interesting part is we'll get the report probably the end of the month, the finalized report. I will share it with the board, and our goal is to be as transparent as possible with this data and get it back out to the community, knowing that one of the biggest issues that everybody has come up with was how do we keep a doctor? Mm-hmm. And again, hoping by kind of being proactive in the discussions that we're having, that will also help. But great information. I mean, to have, I believe it was 38 participants come up, spend an hour of their time and actually speak their mind was very, very beneficial for all of us. And so we're really excited to get that final report and dive through it and figure out what can we do differently and better, and how can we work better in the community.
Mm-hmm. And I think it's important to point out, too, that you didn't have any hospital staff involved in these meetings. These people, these community members were giving their opinions to an outside organization, right?
And I felt that was really important because this gentleman who came in from the Temple area through Torch, the Texas Organization of Rural Community Hospitals, he managed the whole process. So you weren't sitting in there with the marketing director or the CEO or a board member. Mm-hmm. And so I don't know who said what.
Right.
And it makes it a lot better for folks to have that confidentiality and to be anonymous, because you get a lot more of the good, the bad, and the not so good if it is anonymous, and you figure out how do we fix it and go forward.
All right, let's talk about, as much as I hate to, let's talk about Austin and what's going on in the legislature.
Well, I tell you what, through the middle of the legislative session so far, the upside is rural health care has not gotten burned to the point where it could have to this point. There's a lot of stuff going on when you look at the freestanding ERs and the rules and regulations. I think there's up to 16 bills right now in place about freestanding ERs. A lot of stuff out there about Medicaid and cost-based reimbursement for the rural facilities, the scope of care that an advanced nurse practitioner can do in a rural facility, which I think could be very beneficial to places like Muenster. And then also looking at telehealth and telemedicine. There is probably 47 bills right now that are associated with things that could affect Muenster Memorial Hospital. I have the legislative folks all on speed dial. I have sent out emails. Most of the chief of staffs for each one of our legislative people all know me by name, which I don't know if that's good or bad. But it's important for us to get our word out there and to make sure that we're being protected to the best of our ability. With the Affordable Care Act and not knowing what's going to happen with that, we're all just kind of spinning in circles. One of the interesting things, Winston Churchill has a quote. Politicians are the ones that are going to tell you, what's going to happen tomorrow, what's going to happen the next day, a month from now, and a year from now, and then they have to have the ability to come back and tell you why it didn't happen. And so sometimes you feel like a politician when you're the CEO in a rural facility, and sometimes it's out of your control.
Yeah, exactly. And there's politics involved in everything. Day-to-day business has some political side to it, believe me, it seems like. All right, let's talk about another thing that has been in the news a lot lately, and that is cybersecurity. Talk about that and how MMH is handling that.
Well, we're taking a little different approach. We did, and it was in our newspaper this past week, we did a little phishing exercise, and that's phishing with a P, where I sent out a dummy email to all of my staff that had email, and it was a bogus email address, and we tested the system to see how well we did. From that, we determined that we needed to do a little more training, with ransomware, with cybersecurity. The interesting thing for us is we have to follow the same guidelines and be as prepared as a Parkland or a UT Southwestern or these large companies with what resources that we have. So we actually have some training modules that we've put in place, some things that we're doing to help protect us, because there are, and people don't hear about this, there's probably been 25 rural facilities that have gotten hit with ransomware. And it can be anywhere from, $500 to $1,500 to $10,000 just to get your own data back. And so we're trying to be on the forefront. There's no guarantee.
Right.
Yeah, you hit that funny email and it can lock up your system. But if we can do that potential training out there and get it to our people and try to do our best, not only for the hospital, but for your own stuff at your own house, it's beneficial for everybody.
And that's great, because I think up until just recently, most people were just letting the IT department handle it and not spreading the word and giving training to their general employees.
That's true. And, and I will leave you with these two thoughts because I know my 10 minutes are about up and they fly by, First of all, I really, really hope everybody out there that's listening to us has a very good Friday and a very good Easter. Take the time, spend with your family, the ones that you love, because it is a very important time in everybody's life. And I'll leave you with one more Winston Churchill quote, and it says, to improve is to change, to be perfect is to change often. And in healthcare, we must be getting close to perfect, because we are changing literally every day.
Constant change, basically.
That is correct.
Very good. Hey, Brian, thanks very much. Look forward to our next visit.
All right. Thanks a lot.
You bet. There he goes. He is Brian Roland, the CEO at Muenster Memorial Hospital. That's going to wrap it up for our program on this Thursday here at KGAF.